It's estimated about 2 million Australians who need dental care aren't getting it because it's too expensive. Those costs are leading to a waiting list backlog and an increasing number of people going to hospital with serious problems. Both the major parties have made some funding commitments, but for many, it's nowhere near what's needed.
Callie Westbrook spent 5.5 years on the public dental waiting list. In that time, minor problems became increasingly physically and emotionally devastating.
I didn't want to smile, I didn't really want to socialise, I didn't really want to show my face because it made me look like I had a drug addiction.
About 2 million Australians every year miss out on dental care because of cost.
In Australia, 11% of all primary health care is paid for directly and in full by the patient. The rest is subsidised, making it more affordable. But of the $10 billion Australians spend each year on dental care, patients still end up paying for more than half with out-of-pocket costs.
There's only funding available for about 15% of the eligible people to be seen each year within the public sector.
That's seen public waiting lists blow out and a rot spread.
At a very young age, we're seeing kids by the age of 5 to 6, 1 in 3 of them with tooth decay.
The Coalition has pledged $1 billion over 3 years for the Child Dental Benefits Scheme, so families can claim up to $1,000 worth of work. There's also $100 million to help low-income earners and pensioners access the public system, and $350 million for state and territory programs. Labor says it'll match that and deliver another $2.4 billion for pensioners to get $1,000 worth of work every 2 years covered by Medicare. But dentists and patients say more is needed.
More clinics available, more dentists available, more appointments available, and there most definitely needs to be more incentive for dentists to stay in the public sector.
The Grattan Institute is pushing for a universal dental healthcare plan. It says that'll cost $5.6 billion a year, but it says that cost will prevent more expensive problems and can be phased in over a decade.
It is crazy that the mouth is not part of the body as far as Medicare is concerned.
Callie Westbrook eventually got the dental care she needed, but it wasn't through Medicare. A dentist decided to help pro bono.
It's incredibly amazing. Sorry.
And while she can now smile easily, millions of Australians are still in pain. Iskandar Razak, ABC News.